You're on.
Hi, my name is Professor Chris Nutting. I'm a cancer specialist based in London. I specialise in treating tumours of the mouth and throat.
Hi Chris, I wonder if you could tell us a little bit about being diagnosed with cancer of the mouth or throat.
Well, the mouth and throat cancers are relatively rare. Most patients may have had some symptoms for a while, and the particular things of concern are sore throats which don't resolve after a small number of weeks, a lump or ulcer in the tongue which doesn't go away over time, or a lump in the neck.
I see. And what sort of treatment would happen after a diagnosis like that?
Most cancers of the mouth or the throat are treated either with surgery or with a combination of treatments such as radiation and chemotherapy.
And if it's surgery, what would a patient expect with that?
So surgery is mostly used where a tumour can be easily removed without much effect in terms of long-term function. So, for example, cancers of the tongue are often treated with surgery in the first instance, where the removal of the tumour can leave the patient eating and swallowing and speaking normally afterwards. Whereas radiotherapy tends to be used for tumours where the organ in which the tumour is situated cannot be removed very easily.
I see. And what is involved in radiotherapy?
So radiotherapy is an X-ray treatment. It's an outpatient treatment where the patient comes to the hospital each day, normally for a course of treatment which will last each weekday for 6 weeks. From the patient's point of view, they come from home, they have a particular appointment time, they go into a large treatment room where they are positioned on a treatment table. A mask is usually put over the patient's face and neck to hold them still while the radiotherapy is delivered. Radiotherapy is delivered by a big machine, and the treatment takes about 15 to 20 minutes each day, and the patient goes home and comes back the next day for treatment.
I see. And what sort of side effects might there be from that? Would the patient feel tired?
With radiotherapy, normally for the first week or so of radiotherapy, the side effects don't really start until midway through treatment. Typically, as the patient progresses through treatment, they may get dryness of the skin that's being treated on the side of the face or in the neck. That can progress in some patients to more like a skin burn, a bit like sunburn, as a consequence of the radiotherapy. We can treat that with skin care and so on. What's more of a problem is that the same redness and soreness happens on the skin on the inside of the throat as well. And that can obviously be uncomfortable, and it can affect swallowing and eating. So we need to look after patients during that time particularly carefully.
I see. And you mentioned as well drugs and chemotherapy. What would a patient expect with that?
So in some patients, particularly younger patients or those with more advanced tumours, we would use chemotherapy alongside radiation, normally given during the 6-week treatment period. The chemotherapy often means coming into hospital for the day or sometimes overnight. The drugs are administered through an intravenous cannula, like a drip, which is running over a few hours. And typically that's done at the beginning of radiotherapy and then a second treatment towards the end of the 6 weeks.
I see. And will a patient, after take a bit of time to recover from that, and when will they sort of start to feel a bit better, perhaps?
Yes. So usually the course of treatment, actually attending the hospital each day, is a 6-week period.
Yeah.
The side effects of treatment mentioned will take about another 4 to 6 weeks after the end of treatment to settle down. There are some other side effects which tend to be more mild, but difficulties with swallowing, dryness in the mouth and tiredness, which can take several months to resolve.
I see. And while a patient is in that few months after the treatment, what will be going on then? Will you be doing regular checks and things like that?
Yes. So during treatment we have specialist teams of doctors and nurses who look after patients going through this sort of treatment, pain specialists if required, dietitians and other specialists to help the patient to get through the side effects of treatment. Once the treatments are finished and the side effects are resolving, then regular checkups are required, both face-to-face checkups with examinations of the inside of the throat and in some cases scanning as well. And that will tend to go on for the first 2 or 3 years after end of treatment to make sure it's been successful.
Right. And presumably towards the end of that period, they're coming to you less frequently and they're sort of resuming their normal life?
Yes. So we'd hope that with most patients, if they wish, they'll be able to return back to work. And while they may still have some residual side effects for a number of months afterwards, we hope that they'll be able to modify their routine to take account of those.
Thank you very much. Can you say a little bit about how to lead a healthy life and look after your mouth and throat and make sure they're in the sort of best health they can be?
Yes. Well, most of the tumours that occur in the mouth and the throat are caused by smoking or excessive alcohol intake or by infection with the HPV virus. So certainly we encourage people, patients or people who are members of the general public to modify their alcohol intake to avoid smoking if they can and to reduce the chance of catching HPV.
Thank you very much for your time.